Bismillahirrahmanirrahim. Welcome to my channel Science of Life with Dr. Muhammad Yusuf. Today we are going to talk about the second formed elements. RBCs we have talked about, but today we are going to talk about the second important formed elements in the blood that is the white blood cells or leukocytes. As per my routine, one ayah from Holy Quran and its translation. I've selected an ayah from Surah An-Nur, ayah number 19. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم إن الذين يحبون أن تشيع الفاحشة في الذين آمنوا لهم عذاب أليم في الدنيا والآخرة والله يعلم وأنتم لا تعلمون. बेशक वो लोग जो मुसलमानों में बेहयाई फैलाने की ख्वाहिश रखते हैं, आरजू रखते हैं या पसंद करते हैं, उनके लिए दुनिया में और आखिरत में दर्दनाक अजाब है कि जो मुसलमानों में बेहयाई गंदगी फैलाने की आरजू करें या उसमें कोशिश करें या उसमें इन्वॉल्व हों, उनके लिए दुनिया में भी और आखिरत में भी दर्दनाक अजाब है। वल्लाहु यअलमु व अंतुम ला तालमून, तुम कुछ भी नहीं जानते, अल्लाह खूब जानता है कि ये अजाब की सूरत क्या है। अपरेंटली तो हमें नहीं पता चलता कि दुनिया में ये बेहयाई फैलाने वाले लोगों को अजाब मिलता हो, हमें अपरेंटली नजर नहीं आता। अल्लाह पाक फरमा रहे हैं कि अल्लाह जानता है कि उनको अजाब, क्योंकि अल्लाह ने कहा हुआ है फिर दुनिया में भी अजाब है और आखिरत में भी अजाब है। आखिरत तो नहीं किसी ने देखी, दुनिया में हमें अपरेंटली पता नहीं चलता। अल्लाह कह रहे हैं कि आपको नहीं पता, वल्लाहु यालम, अल्लाह जानता है कि अजाब की सूरत क्या होगी और दुनिया। लेकिन हमारा ईमान है कि हम मानते हैं कि अल्लाह पाक उनको अजाब दुनिया में भी देंगे और आखिरत में भी देंगे जो मुसलमानों में बेहयाई फैलाने की कोशिश करेंगे या आरज़ू रखेंगे या पसंद करेंगे। अल्लाह पाक हमें समझ अमल की तौफीक दे। So we are going to talk about WBCs today, white blood cells. Red blood cells we had talked about in previous lectures. The most abundant cells in the blood, we talked about, they are RBCs, red blood cells. These white blood cells, their count is only number of WBCs per cubic millimeter of blood. They are only 4,000 to 11,000 per cubic millimeter of blood. If you remember, RBCs, they are 5 million per cubic millimeter. And these are only 4,000, 7,000, 10,000 per cubic millimeter of blood. They range between 4,000 to 11,000 per cubic millimeter of blood. When their number is more than this 11,000, increased number of WBCs, that is termed as leukocytosis. Leukocytosis means increased number of WBCs, the count above 11,000. That should be called as leukocytosis. And that occurs, increased WBC count, that occurs whenever there is some infection, usually acute infections. Even if after exercise, we will see that RBCs, the WBCs, they may be kept along with the static along with the wall of the vessels, but when the person performs exercise, they come into the full flow, and after vigorous exercise, their number may increase, or their number may increase if there is fluid loss. Of course, when fluid loss occurs, everything is concentrated in the blood. Loss of blood, loss of only fluid will increase even the blood glucose level, or BC level, or calcium level, or so WBC count may also increase. So simply fluid loss. But usually we are most important functions we are going to talk about. They are the defense force against the different pathogens, different organisms, different bacteria. So whenever they enter into the blood, these are required. So their count, their number increases. Leukocytosis occurs in every type of, most of the infections, most of the acute infection, there is increase. And then This was leukocytosis, then leukopenia. What is that? Decreased number of count at WBCs below 4,000. This is the range between 4,000 to 11,000. This is normal range, quite a wide range. 4,000 to triple than that, 11,000. But below 4,000 count, very low count, that is known as leukopenia. And leukopenia decreased WBC count or decreased leukocyte count. This is also known as TLC. TLC stands for total leukocyte count, total number of WBCs. TLC. So TLC below is when it is low. It occurs usually in some infections. For example, typhoid, one type of infection, Salmonella typhi, one type of pathogen which causes, that pathogen also produces some toxins which cause the depression of the bone marrow. So usually in typhoid fever, WBC count, instead of being increased, it is decreased. Typhoid fever, there is leukopenia. And many other viral infections, for example, common flu or measles or mumps or chicken pox, these are all viral infections. AIDS, all these are viral infections. In most of these cases, there is leukopenia, decrease WBC count. TLC is decreased, it is below 4,000. So leukocytosis, leukopenia, these two terms I wanted to introduce. Now, WBCs, which are also known as leukocytes. Leuco means white. Leuco means white. Cyte means cell, white cells. Well, leukocytes means white cells. Their main function, we are going to discuss their functions. They are the police force of the body. They protect against pathogens. So they protect against diseases, bacterial disease. And they are very important part of immunity. We will discuss immunity in 3-4 lectures. Very important defense mechanism, immune response. Yeah, in previous slides, I am going to back to that slide. I want to. AIDS, that is a disease in which immunity is suppressed. Acquired immunity deficiency syndrome. We are going to we may talk when we discuss immunity. AIDS, acquired immunity deficiency syndrome. This is one of the viral diseases, that is the HIV, that is known as, that causes depression of the immunity. That defense system is lost in AIDS. So we will talk about, so they are very important. WBCs are very important in immunity, in the defense system of the body. They are also known as police force of the body. Wherever there is infection pathogen, they go there. Because they are wandering, they are circulating in the blood, and they are concentrated towards the area where the pathogen have entered into the body. So they are police force of the body. So they are very important in immunity. We will discuss this immunity in 3-4 lectures, inshallah. That is the defense system of the body, defense mechanism. So these are the main functions. Primarily, the main functions are this. The leukocytes are divided into two groups of cells. When we classify that, some of the leukocytes, they contain small granules in their cytoplasm. RBCs, we discussed it, those were anucleated. There was no nucleus. We discussed it. RBCs, our nucleus is evaginated. There is no nucleus in RBCs. But in WBCs, nucleus is present. So nucleus, and in the cytoplasm, if the granules are present, those WBCs are known as granulocytes. And if the granules are absent, there are 2 types of the cells, or 3 types of the cell, in which only nucleus is present, the granules are absent in the cytoplasm. So there are no granules in the cytoplasm. So they are termed as the agranulocyte. Granulocytes and agranulocytes. Now these granulocytes, routine histological technique of staining the cells, staining technique, very common staining technique is H&E staining, hematoxylin eosine staining. Hematoxylin is a dye which is a basic dye, and eosine is a dye which itself is an acidic dye color. So combination of this is known as HNAE staining. So when we stain it, if the granules take acidic dye, they should be called as acidophils. No, yes, they should be called as acidophils, but we call them as eosinophils. Eosine is an acidic dye. And if they are the granules, these granules in granulocyte, the granules, if they stain, they take the basic basic dye, that is hematoxylin, or other basic dyes. There are other stains as well, but common routinely used staining technique is H&E staining, that is hematoxylin eosine staining technique. In this, the basic dye is hematoxylin. If the granules take the basic dye, they are known as basophils. Philia means love, attraction, affinity. So they are known. And if the granule take the neutral dye, that is mixed acid and base dye, that is taken by the granule, those cells are known as neutrophils. So depending upon the staining reactions of those granules in the granulocytes, they are divided into neutrophils. If the granules take the neutral dye, neutral stain, not the nucleus. Nucleus always takes the basic stain because nucleus contains DNA. DNA is an acid, deoxyribose nucleic acid, that will attract the basic dye, hematoxylin. The nucleus is usually stained blue, basic dye, that takes the basic dye. But the granules will take, if the granules take the neutral dye, that is mixed pink, eosine is a pink, acidic dye is a pink dye, and the hematoxylin basic dye is a blue dye. Combination of pink and blue, that will be, what will be that color? Pink and blue combined together will be a somewhat violet color, purple color. It will be purple color or violet color. It will be. So neutrophils, the granules will take the, that will be looking like violet, because the acidic dye will also stain, neutral dye will stain. And if they take the acidic dye, they should be called as acidophils, but it is, we usually call them eosinophils. Eosinophil is acidic dye. Acidophils, they can be called as acidophils, but acidophils cells are some other cells we may discuss. You may discuss in your second year classes. Acidophils are the cells in pituitary which take this eosine and acidic dye, so they are called as acidophils. In the blood, they are called as eosinophils, but they are acidophils. So eosinophils, and then the basophils, the granules will take the basic dye. So these are the three types of the granulocytes. And agranulocytes, there are two types of the granulocyte. Lymphocytes, very commonly involved in the immune system, part of the immune system, defense system of the body. Immunity, we will discuss this immunity. So lymphocytes are the cells, they are WBCs. The cytoplasm doesn't contain any granules. And then there is the monocyte, another neutrophil, the white blood cells, monocytes. So these are the five types of the cells present in the blood, five types of WBC. Now again, the types that we have classified, these are the three granulocytes. This is not good picture. I am going to show you the big good pictures as well. So this picture is as one place we can see. So these are the three granulocytes. They are collectively, they are also known as polymorphonuclear granulocytes. I have just named it granulocytes, but their full name is polymorphonuclear. Poly means many, morpho means morphology, shape, and nuclear, nucleus. So nucleus has many shapes. In all these cells, the nucleus is usually multi-lobed. Many shapes of the nucleus, they are known as polymorphonuclear granulocytes. If the granule take the purple dye, this is nucleus. You can see this blue shape, 1, 2, 3, 4, 5, 6 lobes of the nucleus. This is the nucleus, but in the cytoplasm, it is not a good picture. I'm going to show you the actual granules in the next few slides. So they will take the neutral dye, purple color or violet color, that will take, so it is neutrophil. If they take the red dye, That is, granule take the eosine. They are known as eosinophil. This is nucleus. And in the basophils, nucleus is also basophilic, and the granules are also basophilic. So demarcation between the cytoplasmic granules and the nucleus is lost. It is a blue. Many things are blue. It is filled with the blue. So these are the granulocytes, and full name, if you want to name it, polymorphonuclear neutrophil, polymorphonuclear eosinophil, and polymorphonuclear monocytes. Simply, you can call them as basophil, eosinophil, and neutrophil. Then the agranulocytes, usually one nucleus, so they are known as mononuclear. These are the polymorphonuclear, these are the mononuclear, one nucleus. Mono means one. Mononuclear agranulocytes, this is lymphocytes, and all of cell is filled with the nucleus, and this is the biggest of all these cells. Is the this It has got a kidney shaped, bean shaped nucleus. It is a monocyte. So these are 5 types of cells. We are going to explain it. This diagram is showing you the development of these WBCs. All the blood cells, they develop from bone marrow. They develop from the bone marrow, and we have talked about the erythropoiesis. The main cell hemocytoblast is responsible for the formation of this. That is, RBCs are also formed from the hemocytoblast, and the WBCs are also formed. Platelets are also formed from this main stem cell, that is the hemocytoblast. So lymphoblast, hemocytoblast will be converted into lymphoblast, and lymphocytes will be formed. Hemocytoblast will be converted into myeloblast, from where these 3 types of the granulocytes will be formed. This is the development process. आगे भी आएगी. We will talk about that. So development of one neutrophil, that is a neutrophils. Development of neutrophil, these are the neutrophil. Development of neutrophil are eosinophil, basophil. They are from the main hemocytoblast, which is converted into myeloblast, and myeloblast, after several stages, they will be converted into neutrophil and eosinophils and the basophils. We are going to quickly, I will go through the development of the neutrophil. The myeloblast, we have seen in the previous slide. Again, I am going to the myeloblast. Is the parent of all these granulocytes, is the forefather of all these granulocytes. So myeloblast, that is the myeloblast, shape of the myeloblast. It will be converted into promyelocyte. You just have to remember the names. It will be converted into promyelocytes. Then it will be converted into myelocytes. Nucleus is being condensed. Cytoplasm is increasing. And then the metamyelocytes. You can see the nucleus, shape of the nucleus is changing. Cytoplasm is also increasing. Granules are also appearing. And these granules, this is also known as band neutrophil. It is, and then it is converted into that neutrophil. Multi-lobe nucleus and the granule containing cytoplasm. Those granules, they take the violet color, that is mixed red and blue dye, neutral dye. So this is the these are the stages of development of eosinophils. That is, these are the neutrophilic stages. Eosinophilic stages are similar to this as well. The neutrophils, this is neutrophil. This is good picture. You can see these are WBCs. All these are WBCs. This one is the neutrophil. That is multi-lobe nucleus, and there are several granules. You can see the color of the granules. These granules are fine, and they are abundant. Large number of very fine granules which take the violet color, mixed red color. This is the granulocyte, neutrophil. This is neutrophil. So purple granules in acid-basic stain. What is acid-basic? H&E staining. Acid-basic stain, they take the purple color, that is blue and red mixed, and the granules are fine and abundant. Large number of granules and very fine granules. And the nucleus is multi-lobed, 2, 3, 4, 5, even 6, 7 lobes. age, if the neutrophil age advances, the lobes of the nucleus, they also increase. Newly formed neutrophil may be having 2-3 lobes, and when it ages, the nucleus becomes 4 lobes, 5 lobes, 6 lobes, even 7 lobes. You can see 1, 2, 3, 4, 5 lobes. You can see here 5 lobe nucleus. So the lobed nucleus, and this is the cell which is responsible for the first defense system. That is, they reach the pathogens, and whenever there is infection, they are first to arrive at the site of the entry of the pathogen, at the site of infection. Any bacteria entering into the anywhere, these are the cells which will reach there. They are the first defense system, defense line in the cells. So they are first to arrive at the infection, and we will discuss the properties of these WBCs. They are phagocytic. They can perform the phagocytosis. They can engulf the material. They can eat the material. They can send out pseudopod around something and they can engulf it. That is known as phagocytosis. So they are phagocytic, and their count out of those 4,000 to 11,000, 54 to 62%, they are these neutrophils. So maximum, that is up to 60%. You can simply up 60%. Very commonly they are 60%. So, but their range is between 54 to 62%. So most abundant WBCs are these polymorphonuclear neutrophils, are simply neutrophils. So that is about the neutrophils. So they are elevated in bacterial infection. Whenever there is acute leukocytosis will occur, and these will increase. They increase in all the acute infection except that typhoid fever. So they mostly the bacterial acute infection, there is increased number. So they should increase because they are the first to reach there, and they will cause the phagocytosis or killing of that pathogens, etc., etc. So they will increase. So their number will be more than 62%. It may become 70%, 75% when there is infection. When you have got tonsillitis, if you perform the total leukocyte count, it will be more. And if you count the number of neutrophils, that will be more than 60%. That will be 70%, 80%. So those were and eosinophil. This is eosinophil. You can see the granules are red now, because eosine is a red dye. So these are the eosinophilic granules. They will take the red dye or eosine or acetic dye. So the granules are red. All these, the rest of them are the RBCs. So this is, and the nucleus will mostly take the blue dye because of the DNA. There are some eosinophilic material as well, but mostly it is the DNA. So it is blue stain. It has got 2 lobes. It is multi-lobe nucleus, 2-lobe nucleus. Usually it is 2-lobed in eosinophils. And the granules, you can see, they are red and they are coarse. The granules in the neutrophil, I am going back, they were fine, but these are the coarse granules here. They are coarse and not as abundant as neutrophils contain. They are very abundant granules. So red, deep red granules in acidic state. This is deep red granules, and the granules are coarse. They are not fine. They are coarse granules, and usually it is nucleus is bilobed, and moderate allergic reaction. Yes, those neutrophils, they increase in acute infections, and eosinophil, they are required and they will increase in allergy, and they increase in the allergic reactions. They are defense against the parasites. They are also increased whenever there is parasitic infestation. For example, intestinal worms, पेट के कीड़े, intestinal worms, eosinophils will increase. So they are defense against the parasitic worm infestation. And normal count, those were up to 62%. They are only 4%. 1, 2, 3 or 4%. Here it is 4. Only 4%. 1 to 3% written here. 1 to 4% you can say. So their normal count is very low. But when allergy occurs, when parasitic infestation occurs, they may go into 10% or like that. They will increase. So they are increased in these two conditions, worm infestation and allergy. So they are elevated in worm infestation and allergic reaction I've already talked about. So these are eosinophils. Normal count is only 1%, 2%, 3%, or maximum 4%. And basophils, as I said, granules will take the basic dye. Nucleus always takes the basic dye. So there is no clear-cut demarcation between the granules and the cytoplasm and the nucleus. It is a cell full of basic granules, etc. nucleus. It is a basophil. So the deep blue granule, because the basic dye hematoxylene is a blue dye. Methylene blue is also basic dye. So usually HNE hematoxylene is a blue dye. So deep blue granules, basic stain, and the nucleus is again bilobe, not very clear because of the staining reaction, and coarse granules and blue granules. Coarse and blue, and they are very important. This is very important. Remember this. These basophil cells, though their count is very low. How much low? Next, I am going to only less than 1%. Less than 1%. You may not see in a full slide. You may examine maybe 100 cells. You may not see any. You may not find any. Their count is very low. But they are very important because basophilic cells are present in the blood. They are also present outside the blood vessel. They are known as mast cells. They are also basophils. Mast cells and the basophil, they produce histamine. You must have heard this name, histamine, which is very important chemical released in allergy, which is responsible for the many important allergic reaction and even shock, anaphylactic shock, allergic shock जिसको कहते हैं. This is the cause of that is histamine, and histamine is produced by the basophils and mast cells. So they also produce heparin as well. That is an anticoagulant. We will discuss coagulation of the blood, and we will see these are important for the production of heparin as well. That is an anticoagulant, and their count is less than 1%, very low count. But they will increase in allergy. They will be produced this. So this is again a basophil. You can't demark the boundary between the cytoplasm and the nucleus. This is a basophil. By the way, in this slide, these are platelets. We will discuss platelets somewhere else. These are small platelets, third formed elements. Better slide is for that purpose is the previous slide. These are the platelets. Small fragments of the cells are these are the platelets. No, this is one platelet is there. So these are the platelets. So these are platelets. In this slide, these are some platelets. No, they are not visible here. This is a neutrophil. So granulocytes, collectively, there are three types. This is the neutrophil, and neutrophil, this is neutrophil, this is eosinophil, and this is basophil. At one glance, you can see the difference between the granules are blue, granules are red, and granules are violet color. So these are the three types of the granulocyte. And two other cells, the A granulocyte, so we are going to that. A granulocyte, the one is the monocyte. Monocyte, this is monocyte, bean-shaped, kidney-shaped nucleus, and in the cytoplasm, usually there are no granules visible. So it is rest of these are the platelets, and rest of them they are WBC, the RBCs. So the largest blood cells means their diameter, total diameter of this is about 18 micron. Diameter of RBCs we have talked about, it is 7 micron, 7 to 8 micron is the diameter of RBCs. This is double than that, or more than double. So it is 18 micron, which is the biggest blood cell formed element. So the largest blood cell, kidney-shaped nucleus or maybe oval nucleus, and they are very important in this respect. They leave the blood vessel, sorry. They leave the blood vessel, they enter into the tissue surrounding around the capillaries, and they are converted into macrophages. We are going to talk about macrophages in detail in maybe in the next lecture. Macrophages, they are the bigger than these. They become very big and they can engulf many bacteria. So in the tissues, there are many tissue macrophages. These are the macrophages in the blood, and when they come out of the blood vessel, they become very big and they may be attached to some tissues. So then they are known as the tissue macrophages. They develop from these monocytes. Monocytes, they leave the bloodstream and they become macrophages. In the liver, they become macrophages. They are known as Kupffer cells. In the brain, they become histiocytes, and in the skin they become histiocytes. And there are tissue macrophages, alveolar macrophages. So these macrophages are present throughout the body, throughout all the tissues, and they develop from these. They leave the bloodstream and they become macrophages. Their count, normal count, is between 3 to 9%. Normally, there you may find a few cells when you perform this DLC, differential leukocyte count. So their normal count is about 9%, 3, 4, 5, 6, up to 9%, and they are elevated in acute infection, even in typhoid fever, and malaria and tuberculosis. They are also increased. So this is one type of agranulocyte. The last one, lymphocytes. The last one, lymphocytes. This is lymphocyte. You can see lymphocyte is almost a nucleus, only nucleus. A small rim of cytoplasm is visible. Small amount of cytoplasm. Mostly it is the nucleus. So most of it is, and in the cytoplasm there are no granules. Their importance is about the size of RBCs. About the size of RBC, slightly bigger than RBC, you can see, about the size of RBC. So the large spherical nucleus, you can see, and there is thin rim of cytoplasm, a small amount of cytoplasm around this nucleus, and they are divided into, functionally they are divided into two types of very important cells. One is T cells and the B cells. There are two types of immunities we are going to talk about: T cell immunity and B cell immunity. We will classify the immunity. So these lymphocytes, functionally they are divided into T cells and B cells. B cells, they give humoral immunity, and T cells, they give these cell-mediated immunity. So we are going to talk about, so these are concerned with the immunity. They are very important for the immunity. Important in immunity. We will discuss the immunity in 3-4 lectures, and we will discuss these T cells and B cells many times. We are going to talk about these. So these are the lymphocytes. So they produce, B cells usually produce antibodies, and T cells are involved in the cellular immunity. I'm not going to in detail what is cellular immunity. We will discuss in that cellular immunity at the proper time. So normally their count is between 25 to 33%. That is of the total leukocytes. So up 65% are the leukocytes, those neutrophils, and up to 32% are 30. They are these. So most of these blood WBCs are neutrophils and lymphocytes. A few basophils, a few eosinophils, and a few monocytes. Their count is very low. So these are the cells which are responsible for immunity, and these are the cells which are lacking. They are decreased when the person is suffering from AIDS, acquired immunity deficiency, or HIV infection. AIDS, these T cells, there is suppression of these T cells and immunity is gone. This is actual electron micrograph of actual cells. These were the small, this is the light microscope, shows the cells like this, but the on electron microscope, this is the T cell. Not T cell, it is a lymphocyte. Maybe T cell, maybe B cells, but it is a lymphocyte. This is the scanning electron micrograph, SEM, of the image of a single human lymphocyte. This is lymphocyte. This is again a lymphocyte. That is, whole of interior is filled with this nuclear material. count we have talked about. TLC, total leukocyte count, the first slide was this. That is their count is 4,000 to 11,000. And in leukocytes, there is increased count, then an increased WBC count. We know this slide. And that leukocytosis occurs in acute infections, exercise, and loss of the body fluids. And differential leukocyte count, what is that? This is TLC, total leukocyte count. And DLC, differential leukocyte count, means we calculate the percentage of different types, these 5 types of the cells, percentage of these different types of the cells we are going to count in differential leukocyte count. List the percentage of the types of leukocytes. So may change in particular disease. This DLC changes. Normal DLC, that what is that? 60% neutrophils, 4% eosinophils, 30% maybe lymphocytes, 8% those monocytes, and maybe 0.1% or 1%. This is normal DLC. If infection occurs, then the neutrophil will increase. They, instead of 60%, they may become 80%. If allergy occurs, the eosinophil will increase. Instead of 4%, they may go to 10%, like that. So it may change in particular disease. This DLC, this is normal DLC. That is, neutrophils are between this, eosinophils are 1 to 4%, basophils are less than 1%, 0 to 1%, lymphocytes are 25 to 35%, and monocytes are between 3 to 8%. This is known as DLC, differential leukocyte count. Now, clinical significance of these. What is the importance of this? Leukocytosis, this is clinically. Whenever there is infection, there will be increased number of WBCs. Leukocytosis, acute infections, inflammation, there will be increased number of neutrophils. DLC जब करेंगे, that will be, instead of 60%, it will be 80%, 75%. So this is known as neutrophilia, increased count of the neutrophils. So acute inflammation, acute infection, increased neutrophils. And chronic inflammation, like tuberculosis, there is increased number of lymphocytes. And in allergy and worm infestation, there is increased eosinophils. We had talked about when we are looking at the eosinophils. And leukopenia, leukocytosis, increased number of this, and leukopenia, decreased number of WBCs. So whenever the bone marrow depression occurs due to any reason, maybe we had talked about the atomic radiation, X-rays, or some chemicals which can suppress benzene containing. We talked about the bone depressing chemicals when we were discussing erythrogenesis or formation of RBCs. So bone marrow depression due to any reason, due to some typhoid neurotoxins, hemotoxins, that is, bone marrow depression will occur because of those. And X-rays may destroy the bone marrow. Or atomic radiation, especially the gamma rays, may destroy the bone marrow. Or some chemicals like chloramphenicol, I gave you the example of that in that lecture, erythropoiesis. Some chemicals, benzene containing chemicals, they suppress the bone marrow and the formation of WBCs as well as RBCs. There is anemia as well as leukopenia. So some infections like typhoid fever, because of the some new toxins produced by the Salmonella typhi, that pathogens that produces some toxins, chemical, which suppress the bone marrow, and the leukopenia will occur. Now the leukemia, that is another condition of the clinical significance, that is the cancer of WBCs, usually called as blood cancer. What is that? Leukemia, that is the malignant leukocytosis. This is normal leukocytosis. This leukocytosis, acute infection, this is routine. It may go to normal count is 11,000. It may go to maybe 15,000, 17,000, like that. But in leukemia, it goes into maybe lakhs, maybe 1 lakh, 100,000. So leukemia, that is, there are 2 types of leukemia. If the leukemia is that of this granulocytes, usually neutrophils, myeloid series, myeloblastic series, If there is leukemia of these cells, granulocytes, then this is known as myeloid leukemia. And that is bone marrow produces too many immature granulocytes. Large number of granulocytes, they are abnormal, they are immature. And the leukemic cells, they crowd out the other blood cells. When the leukemia occurs, all the other cells, they vanish. They eat, they take up their share as well. So leukemic cells are the cancer cells. These are the cancer cells. They crowd out other blood cells, and the anemia will occur. Anemia is common in all the leukemias. Leukemia में anemia भी common होता है. So it is the myeloid leukemia. It is classified into acute myeloid leukemia and chronic myeloid leukemia. That is out of this scope at this level of first year MBBS. So usually bleeding also occurs in the leukemias. And there is when these granulocytes are there, but they are abnormal, so the person is more prone to infection, susceptible to infection. Very common infection, are common in all the leukemic patients, because the WBCs are more, but they are not capable of performing their normal defensive activity. So this is myeloid leukemia. Then the other type of lymphoid leukemia, if the lymphocytic series, lymphocytes, they are increased, lymphoblasts are increased. So lymphocytes are cancerous, lymphocytic cancer, and symptoms are similar to this. To myeloid leukemia यही काम होता है. That is the anemia भी होता है, bleeding भी होती है, and infection भी common होती है. And the treatment of leukemia, this is beyond our scope, but treatment is, that is blood transfusion because of this anemia, bleeding disorders and infection, etc. And marrow transplants. Marrow is removed and the healthy marrow is introduced, marrow transplant, and anti-cancerous drugs, with drugs which can kill the cancer cell, which is known as chemotherapy or even radiotherapy. And now the treatment is stem cell transplants. Marrow transplant के बजाय stem cell transplant. Now the stem cells are available and the bone marrow may be formed, all the cells may be formed, stem cell transplant. So this is the treatment. This is of course beyond our scope, physiological. This is when you go to higher classes, you will see that. So this is about the WBC's basic understanding of WBCs. We will talk about the WBCs. Next lecture, we are going to talk about the properties of leukocytes, their properties, how they perform their activity. So properties. Thank you very much, and hope you are following me. And if you have got some questions, some queries, you can ask in my comment section. You can ask. I will happy to answer. And please do share. Please subscribe. If you have not subscribed my page, please subscribe and let the other people, other students and your acquaintance, they may you share these slides to others so that the most of the people can benefit from these slides. So thank you very much. Hope to see you in next lecture, inshallah.